Okay, cool. Well, this is exciting. Thanks for watching our video. Today we have on Dr. Curtis Andrews. He's a internal medicine and pediatrics physician in South Jordan. And I've known Dr. Andrews for a few years. He's a great guy. His wife's in dental hygiene school, so talked with her a little bit. We share some similar experiences on that journey. So thanks for being here while we're in this unique and challenging time with COVID-19 and the world kind of on hold and lots of fear and uncertainty. So we're hoping you can shed some light and help us all sleep better and not live in fear, be a little more calm. So anyway, just tell us a little about yourself and maybe some trends you're seeing with COVID-19 and how Utah is doing compared to other states, if we're bad, good, somewhere in between. Tell us a little bit about that.
Sure. Awesome. First off, I mean, thanks so much, Tyler, for inviting me to come on and do this little video with you. It's great to be able to chat with other people in the healthcare field, and we're all definitely feeling the stress in healthcare and in all the businesses in Utah and around the country. But anyway, yeah, thanks for inviting me on. So I guess maybe your first question is a little bit about me. Born and raised in Utah, been here. This is home for me. Been back here since 2013 and settled into South Jordan with my family, and we're just super happy to be here and serve our community. We have a
and you have all those cool medals up there behind
you.
Yeah,
a few little fun excursions that my wife and I did.
You're a lot taller than me too, so you can run a lot farther.
You would think long legs make you run faster, but for some reason I'm a slowpoke.
Yeah, no, I don't believe that. You and your wife, you're always running or biking or something, so that's great.
Yeah, we have a lot of fun doing that. Keeps us active, doing something different challenges.
Cool.
So, well, I guess the first thing is Utah, maybe specifically on kind of how COVID has been affecting us. It's changing all the time. That's one of the biggest things that we are seeing in our primary care practice is different guidelines, different recommendations, both nationwide and locally from the Utah Department of Health, and us trying to keep up on those is very challenging. We have made some changes to our practice where we are no longer inviting people who have respiratory symptoms into the clinic, and we have a little drive-through type situation where we'll do a telemedicine visit, and if they need an examination or some sort of a swab or a test, then we have them drive through and meet people who are fully gowned in protective equipment outside. So we try to do that to serve our maybe chronically ill patients, if you will, and those babies who need to come into the clinic and get routine vaccinations or well child care, so they're not at risk. So we're trying our best there, but man, it's challenging. Utah's been doing fairly well, I would say, as we compare to some of the hot spots in the country. It's tough to say exactly why that would be, but I think some of it speaks to the way Utah is set up. We're a little bit more spread out, definitely, than New York City, and I think that's playing a big role in the high numbers of cases and deaths we're seeing in New York, and I think probably that we saw in Seattle. The previous kind of models were showing a spike of COVID cases the end of April, and I think just today they said that they were expecting that peak to be later this week. And honestly, I kind of think that would be a good thing. If we're peaking already, then that means maybe we are flattening this curve and we are getting ahead of this disease.
Yeah,
interesting.
I've kind of been looking forward to that curve too, just knowing that kind of the sooner we get it, the sooner we can pull that dagger out and move on, hopefully.
I know, right? Get back to normal life a little bit. It'll be graduated when we do finally get back to normal life, but it won't be everybody just run out to the store again. Right. Dr. Fauci, who's leading the CDC and has led the CDC for multiple presidencies, multiple years and years, and been through a lot of pandemics and problems. He praised Utah and kind of how we're tracking and what we're doing as far as trying to keep people socially distanced and isolated. So I think we're doing a good job overall. The leaders have been great.
Cool. Well, that's great. Yeah. Do you think, I mean, typically Utah, we probably have a lower rate of smoking. Maybe, do you think that had to do with maybe why Italy or some other places had more issues? As you mentioned, respiratory, you weren't seeing respiratory patients in the office. Anything to do with a lower rate, or is that not really been a factor in this?
That has been mentioned actually in some of the literature, that a lot of these countries that are hit really hard do have either a older population. Italy, for example, has a pretty old population compared to our state. I mean, tough to compare a country to a state, but do the best we can. And definitely, yes, patients with asthma, patients with lower respiratory chronic disease are going to fare much worse, we think. So the fact that we do smoke a little bit less in Utah, gratefully, is probably helping some.
Cool. That's good. So tell us maybe some trends you've seen in your practice. We talked a little before the call about telehealth, or kind of what you're seeing is that, telehealth, as well as, what you've been treating, or what it's been like in that snapshot of what you see day in and day out.
Sure. Yeah. It's, so we have not had a telehealth part of our practice. We've had very extended hours, and we try to get people in and see them, and it's worked out very well. And then this has put a halt to that. So that's been interesting, but we've initiated telehealth, and basically we've seen some of our chronic care patients who don't want to come in. We see them through the video chat, and of course those with illness. And gratefully, we have only had one positive COVID patient so far since we started doing that. Approximately, I guess it's been about 3 weeks now that we've been doing that. Lots and lots of people tested, and lots of negatives. So we're still seeing, just common viral illnesses, common flu-like illnesses, and just viral illnesses that are causing people to be, coughing and short of breath and low-grade fevers. So, but that's been interesting. And we're definitely seeing more and more fear, if you will, amongst our patients. Patients are coming in fully clothed, head to toe, gloves and everything else, trying not to touch anything. And one interesting thing as we talk about how to protect ourselves, the CDC and Governor Herbert even came out, did a press conference with the mask on the other day, trying to show that that's kind of the trend they're recommending, is as we're going out to places where we can't stay 6 feet away from other individuals, wearing a mask is probably a good idea, where before we weren't saying that was necessary. That's interesting.
Yeah, well, that's great. I know, we started doing teledentistry really last around Thanksgiving. I just saw a need for it, especially on holiday weekends. Without fail, we always joke, is if it's your birthday or a wedding or a holiday, you're going to have a toothache.
That's when you get a
you're going to get
toothache,
sick, or something's going to happen. So, Thanksgiving weekend, we actually did our first official teledentistry call. And while I don't see it replacing everything, because most what we do has to be in person, I think it's a great stepping stone or tool to use. And especially right now, we can get people a prescription, or get a good visual on what's going on, and if nothing else, ease people's fears a little bit, that that they're not dying, or other kind of things.
I agree. I feel that maybe medicine might change after this. We might be waking up a little bit to the reality of what we can do technologically, and how we can best serve people. And sometimes it's great to see somebody in their home environment and see what that's like, or it's nice to talk to somebody for a simple visit and not have to have them spend 2 or 3 hours out of their day to travel and wait to travel home. So that's been kind of nice, and we'll see if this continues or not.
Well, I think for all of us, we're busy, life happens, and sometimes we put things off, and even a virtual visit has got to be better than no visit. So if if it's a matter of, at least getting a pair of eyeballs on what's going on, talking through something, hopefully can help people out, well, cool. Well, tell us, maybe what resources or, precautions we should go. I always say that Dr. Google is a double-edged sword, and maybe some of the sites we should be looking at that are more reputable, and maybe things that are either false or things being perpetuated that maybe we shouldn't buy too much into, and things that we should pay more attention to for our patients and guests who are watching this? That's
a great question. I'm just cheating for a minute because there's one new website that came out, and I want to make sure I say it the right way. There it is. So coronavirus.utah.gov is a great website that just has the basics. It has a great site for healthcare providers. It has a great link for community, how to protect yourself. The CDC has a great site as well. Even they have a link up just recently about how to make your own mask and different options for doing that sort of thing if you wanted to protect yourself out in the community. So those are two things. There's been a big push from the quote Silicon Slopes area. Qualtrics is doing some data collection, trying to really help people find testing sites if they are having symptoms, if they're having a hard time getting into their doctor. So testutah.com is that website. And I will say I went through it myself, and it's a little bit interesting because it asks a lot of personal data, but they are trying to get demographics of who's sick and trying to find out where people are sick. And honestly, it feels funny to put in that personal data, to be honest, but that's how they're doing some digital tracking of where the hotbeds are even in our community. So that could be helpful if you want to go to testutah.com and find a testing site. One quick thing about testing, some people are very concerned or frustrated by the low number of tests that are being provided, I guess, to the community, and maybe how we're limiting testing to those who are only severely symptomatic. For flu, we compare coronavirus to flu a lot just because it's a similar illness and a similar time of year. We tend to get about 50%, that's probably high, maybe 30% of people who are tested for the flu test positive. And for coronavirus, we're seeing more like 5%. So what that tells you is we're actually testing a lot of people. We're testing a lot of people who are negative. So our inclusion is probably just about right now. As more testing options come, different types of tests, I think that'll expand. But anyway, I think the biggest thing, follow the guidance of our leaders. Stay away from other people, avoid big groups, even if you're outside. Every day we go out and we see more and more folks at a park or more and more folks on pathways. And we're just risking ourselves, I think. So trust the process. I know it's hard. I know it's beautiful weather, 70 degrees out there and sunny, and oh man, just so nice. But try your best to just rein in a little bit, give it a couple more weeks, and I think we'll get through this.
Yeah. I keep saying, it could be a lot worse. If it was the middle of January and we got hit with this, I think we'd all feel a little more gloomy, but at least it's the sunshine and we can go out in our backyards and,
yeah, you're right.
move around a little bit, but yeah. And I've wondered, the U.S. overall has been more aggressive in testing than other countries, would you say? I know we probably don't have as many tests as we want, but I've wondered if maybe the count's gone up higher because, I know this has been talked about is because we're testing more, whereas maybe China took longer to get the tests out because they didn't realize what was happening until they were already into it. Or, do you have any feedback?
I don't know that I could speak with a whole lot of power behind that question, to be honest. Tracking the statistics, some people are very hesitant to believe the China data and the numbers that are coming out, saying that they're underestimating what they're actually, or underreporting what they're doing. We see a lot of sick people. New York is not pretty right now. That's kind of the big hotbed.
Yeah.
So it's, and in a big city like that, it's hard to distance yourself, right? So I think that's where we're doing a good job. But we're trying hard to keep up. There's a test that came out, a lab that advertised themselves to us recently, and we've been trying to send them samples, but honestly, they're a week or 10 days out because they're getting flooded with samples from other parts of the country that are a little bit higher priority right now. So I think nationally we're doing a good job. We're trying our best, and just gotta hang on.
Yeah. Well, I know, we still have patients calling because we're still seeing patients, mainly, broken teeth and things, but people are like, I didn't even think you'd be here, but we feel like we have a responsibility to keep people out of the ERs, because basically if someone's in an ER, they're just kind of clogging up the people who maybe need to be on life support, or maybe people who have COVID-19. then they'll just get sent back
Right.
to the dentist anyway. So we're trying to mitigate that as much as we can. But, it's a tough call because we don't want to put people at risk. So we're just keeping the group small and everything. We'll get through it. It's just a couple tough weeks. And I keep thinking, the flu still has beat the number of deaths this year, right? Compared to COVID-19 so far.
Yeah, by far. Yeah, influenza is always, it's always a big one. Influenza and influenza-related pneumonias is always one of the biggest killers that we ever see all year, and we're used to it. We're like, oh yeah, the flu, and oh yeah, I think I had the flu last week, and it's just something that we're used to, and so we don't wash our hands as much, and we don't be quite as careful as we go out and about, and it's still a terrible virus, and it does kill a lot of people. But yeah, it's still ahead of coronavirus.
And maybe next year we'll take the flu season a little more seriously, right?
Yeah.
Because when we say flu, you're talking real flu, right? Like influenza, not like what people call stomach flu and other things, right? The actual, the real.
Yep.
And
yeah.
I keep thinking that the amount of time missed from work from flu season is kind of spread across the whole winter. With this, we're like, if we could condense our flu season down and say, everybody wash your hands and stay home for 2 weeks and move on,
Yeah.
not to say the answer to it, but it would be interesting to see how it would compare to this,
It would be. We've definitely seen a sharp drop off the last month or so as we tried to separate ourselves and be more cognizant of washing hands. Flu has essentially just dropped off. It always does in this time of year anyway, but it would be interesting to see how we do next year if we remember and take all those precautions. We'll see what happens.
Yeah, maybe we'll be worrying about something else by then, right?
You're right.
Yeah. Well, cool. Well, we appreciate all the feedback and info, and we'll share this with our patients. It's great to have you as a resource, and thanks for sharing some info. I think I'm holding strong to saying that fear is still one of the worst side effects of this virus because of this. Most of us will end up being okay, and those at risk need to take extra precaution. But this is great to get some great advice from someone who's seeing patients and testing patients. If you can tell us, if someone has a question, we run into a lot of patients who don't have a regular physician, so we would like to get them to somebody who we trust and know. If you have some contact information, or if someone has a question, or they want to come see you or get a hold of you, how they would do that.
Sure. Yeah. Thank you. So our clinic is Copperview Medical Center. We have a website at copperviewmedical.com. Our phone number is 801-567-9780. And we are in South Jordan, just right off Bangor Highway on 9800 South. We still have our extended hours. We're open Monday through Friday till 10 o'clock. We're open Saturdays and Sundays till 8 p.m. So we're available and we're around. We definitely have people who can see you, either sick or not sick. We're definitely seeing a lot of anxiety and depression, those sorts of things flare up right now as well, and trying our best to help people cope. So please, if you need some help that way, or just with new medical problems, please let us know. We're here to serve you. So thank you very much for letting me come on and chat with you a little bit.
Yeah, absolutely. Thanks a lot for sharing and helping our patients, and we appreciate your time.
Yeah, thanks, Tyler. Have a great rest of your day.
All right, you too. We'll see you next time. Thanks.
Okay, bye.